Hello again, everybody. This is Dr. Glenn with Infinite Wellness, and we're back with one more of our meet and greet series. Today we have somebody very special for you. We'll be introducing her to us. She is coming to us from the side of medicine that oftentimes you'll hear me talk about that we don't often collaborate. And so today is very special. So today we have Dr. Ami Patel. She is a holistic hormone pharmacist. And not something you hear combined very often. This is her own business. This is something she has created. And we've had a chance to get to know one another a little bit, talk to each other, and we have a lot in common. But first, I'm going to let her tell us what it is you do.
Thank you so much for having me here. I'm really excited to have our conversation today. So a little bit about what I do is I specialize in PCOS, polycystic ovary syndrome, helping women conceive naturally as well as perimenopause. So I provide support with a holistic lifestyle change. So that means I help women manage things like stress, sleep, nutrition, exercise, and mindset as a way to improve the underlying things that contribute to PCOS, like inflammation, insulin resistance, and maybe another hormone imbalance.
Absolutely. So a lot of what you're dealing with, broken down into simplicity, is fertility and balancing women's complications, the difficulties they're dealing with that these days.
Yes.
And we're seeing a lot more of that, aren't we?
We are.
Yeah, it's becoming very common. For many years, and how we kind of work together, most of my work has been done. I know most of you already know that I do a lot of fertility work. I have several videos on about some of the work we do through acupuncture and on that alternative healthcare side of it. And of course, we delve into the things you also spoke of, lifestyle changes sometimes, increased exercise, decrease in certain poor food choices, trying to help. But that hormonal balance, I think, is our real common denominator. And so, we see a lot more of this. Fertility issues and hormone imbalances have taken a big rise. And I don't know what you've seen as far as in your practice, but in mine, I think we're getting a lot of that from our foods and the things that we're consuming from our environment. Yeah. So even our water, starting to see a lot of imbalance, huh?
Yes.
Yeah, I think so as well. So for those who don't know as well, when you said PCOS or polycystic ovarian syndrome, I've heard it called polycystic ovarian disease again lately. We love to medical, we love to classify everything as a disease, right? Explain to us really what is going on with that. How would you describe polycystic ovarian syndrome?
Yeah, good question.
Thank you.
I laugh because it's, how much time do we have?
Oh, right, I know. It can get pretty deep, can't it?
It can.
Sure.
To keep it simple, it is a hormone imbalance caused by different things like stress, high cortisol levels, insulin resistance, which means high insulin levels, and your body not being able to process and utilize the insulin correctly. Inflammation is one thing that can contribute to it. A lot of environmental toxins, so a lot of the products we use nowadays, whether it's like lotions, makeup, the foods we eat, they contain toxins or chemicals, and some of those can resemble our natural hormones, which can cause confusion to the body in terms of like which ones to eliminate, which ones to keep, and that can contribute to a hormone imbalance. And usually with PCOS, it's a combination of all of these things. About 70 to 80% of women with PCOS have insulin resistance as one of the factors that contributes to it.
Absolutely.
And so one of the best ways to manage it long term is to address these different factors with lifestyle changes. And there's a time and a place for medications. So sometimes medications can be used to help manage some of the symptoms.
Absolutely. And that, I'm sure, as we've talked before, a lot of chiropractors were all here saying no to medications and stuff. We are not those people. We do believe that sometimes medication is a necessity, but as a short-term help and an aid, as opposed to a lifelong commitment to something that we know is going to alter body chemistry. So it's nice to have somebody who, on this side of the field, like we both understand that this is, this is a multifaceted approach. There's a lot to be taken into here. And when we're dealing with something like PCOS, I think that the part you brought about, the inflammatory side, I think that's what most people associate with PCOS, most women anyway. They go on looking onto the internet, looking for providers, looking for people because of pain. And pain comes from that inflammatory response all along most of what is the entire female hormonal genitalia. And there's a lot of real estate there. We have ovaries and uterus and all the different tubes that connect all of this stuff. And then, of course, it's a lot. It's a lot to take in. So, taking out the anatomy degree portion of it, there's a lot of real estate in there that can be inflamed, isn't there? Yes. Yes, and we hear about it in particular when we say PCOS. We're talking about the ovaries, but this can spread down. It can affect the fallopian tubes. It can affect the uterus. It can become really out of control due to that inflammatory response.
And actually, it can also be low-grade inflammation that
Correct.
just affects your whole body, and that can present as things like acne, rashes, skin conditions, things like that.
Absolutely, yeah. We start to see it affect lots of other facets as it comes out of the body. And so, yeah, I think a lot of that is very, very important. Again, like us, we treat this from a very oriental aspect. In acupuncture, we look to the meridians to try to help balance, to bring the inflammation down, but also really our focus is to try to help reset a lot of the hormonal imbalance. That's where we see a great deal of our stuff for fertility. That's my small subsection of that. But with PCOS, I think we're dealing, like you said, almost with a whole body approach, because there is so much of the body that becomes involved in that inflammation. And like you already alluded to, I'm sure, with adrenal issues, adrenal fatigue, that increase in cortisol, and that of course throws off. Now we've got digestive issues, we've got lack of processing of our sugars. Yeah, it gets really radical. So yeah, she could probably spend all day, couldn't you? Tell us all day about the systemic effects. Right. And I'm sure y'all want to hear all of that. We will have questions. I promise you can ask questions. If you answer, I will answer what I can of them. If you ask us, I promise to refer to Dr. Ami for anything that she would answer way better than I can. But yeah, this is really nice to be able to have this, kind of a dual edge approach, to have a trusted individual, somebody that is dealing in women's health and really, kind of bringing about that change for women. I think that's awesome. Oftentimes women don't want to come trust just a guy for a lot of that stuff, right?
Yeah.
We're comfortable. Yeah, well, we're comfortable with light. You can see too many guys run to a woman for, anything that would involve sexual anything, right? Because we're just that way. And so, yeah, having a trusted female makes this really important for us, so that I have somebody that I can say, look, this is somebody who can really help guide you and, bring about some real effective change in your body, as opposed to just saying, okay, run off to your, local physician, your gynecologist often, and just be medicated. And we talked just for a moment. I'd like to bring this into the conversation because I think it's really important. I don't have a prospectus on this as a male, but Dr. Ami has been through some of this. You've dealt with this before. And medicine's answer oftentimes are birth control and other things of that nature. And I hear that didn't go so good for you.
Yeah, so I actually have PCOS as well,
right,
which is how my work started, because I was struggling to get the help I needed. It took me 3 doctors and over 10 years to get a diagnosis to start.
Wow.
Yeah. So the first one said that, you'll just outgrow it, it's just stress.
Oh yeah, we hear that often in the youth, don't we? When we're younger,
and then
you'll outgrow it.
Yep. The second one said, just try birth control for 3 months to reset your cycle.
We hear that.
That didn't work, because that's not how birth control works. And
not
then
at all.
The third one finally diagnosed me with PCOS. But then with that diagnosis, all she said was, well, you may struggle to have kids later, and if you do, we can give you more medications. But here's a prescription for birth control for now, and I'll see you in a year.
Oh my.
And she said it can help with my acne as well. And at that time, I was in my last year of pharmacy school, but we hardly learned anything about birth control or PCOS, so I just blindly took that advice for 7 years.
I feel your pain coming through our school saying, that wasn't something we had, as chiropractors. We get a short little OBGYN course, but it's crashed into one semester, right? We don't talk about things like PCOS. Like, that's the least of our worries. They give us the basics of uterine cancer and how awful it is, and, what medicines are being used. So we get that, but they don't really, I don't think, ever explain to us the things that women are going through on a day-to-day. And yeah, it's been a difficult diagnosis for a very long time, I think. And it's kind of sad. I've been in this field now 20 years, and I started treating girls with PCOS 20 years ago. I've been here 26 years, but about 20 years ago is when I started really looking more towards the fertility side with acupuncture and studying. And yeah, I had to learn everything about PCOS on my own. Right? They didn't teach us that.
Right.
Yeah, that wasn't part of our school, was it? No. I know. And that's, I think, where medicine has often failed us a lot, is that we've gotten to all you need to know is patient comes in, here's their symptom, give them this, right? And we lost that knowledge, I think, of how to address a person as a whole, try to get them healthier, try to help them navigate some of this and get things back in balance.
Yeah, and then the biggest misconception with PCOS is that it's only a fertility problem, but it's like what you were saying too, that it actually affects an individual every single day for like their whole life.
Absolutely. Literally,
like,
it can become an all of your life problem. Yeah, if those hormones are imbalanced, oftentimes we see it. I think probably the earliest is when girls begin to get their menstrual cycle and it's severely dysregulated. We see that dysmenorrhea, fancy term there, but over excessive bleeding, too much pain, all kinds of symptomatology we've seen. Then they go through there and we deal with the fertility issues of that middle area, trying to get pregnant and stuff like that. And then it comes back to haunt them yet a third time when the hormones change for menopause.
Yep.
And so, it becomes like a whole life thing if it's not addressed, doesn't it? Yes.
Exactly
Yep. And I think that's probably a big portion of why I think this is a very important one. And I'm so glad that I got to have you out here with me to kind of, show everybody that, look, this is going to take a multifaceted approach. It's not just one thing. It's not easy. And that goes for everything we usually talk about, but in particular today, this. And we start to see that, look, this whole difference in change in lifestyle, becoming healthier, finding alternative type things to treat it, as opposed to just running in and like you said, the gold standard for 20 years has just been birth control. And the side effects of that, I think, have gotten worse as the years have clicked by. We went from just oral birth control to intrauterine devices. So a lot of the girls know about those, where they're put in, they're left, and they create all kinds of disruption. I've seen some really radical stuff with that over the years as well, because every person is different. And we talked about that earlier, right? Even managing this, it's going to be different. Everybody's hormone imbalances, are not going to be the same.
Exactly. Yep.
So, yeah. Well, great joy having you with us, Dr. Ami. This has been fun. And we're trying, ideally, we're going to have a board panel at the end of all this. I've been interviewing a lot of different providers. And so I'm hoping to get us all together maybe one day. It's a challenge to get a bunch of providers together on one day, but maybe have almost like a big roundtable type discussion where I'll have some of my patients and people come in and they'll just fire questions, and all of us will have the opportunities to show how all of us work together and how so much of this is available now, where the alternative healthcare field is expanding massively. Definitely. And I think that's one of the best things for the patients. Patricia, you had a question?
I know we talk a lot about stress and hormones and all that stuff, but nutrition specifically, could either of you talk about how nutrition can correlate with your hormones?
Absolutely. That's going to be a long talk, wouldn't it? It would be tough. Simple answer on that's going to be hard. I think honestly what it's going to come down to is we have to realize that when it comes to dietary consideration, a lot of things that are in our food right now are what we would call hormone disruptors. Am I right in saying that? I think you can start reading about this. You're going to see a lot more of it coming out in the news recently. Things like glyphosate and all these things they're trying to ban, unfortunately, are hormone disruptors. So really, we're not specifically eating to fix our hormones. We're eating to get rid of the garbage and allow the body to fix our hormones, if that makes sense.
Yes.
I think that's sort of what we're trying to do, is eliminate some of this stuff that is disrupting hormones so poorly. So
I think it's important to be aware. A lot of times things that are like labeled as healthy or disguised as healthy, being aware of maybe how much added sugar is actually in that food.
Correct.
And if one of the first three, so if we look at the ingredient list, it goes in order of what is in that product the most.
Predominance.
And if the first three ingredients are sugar, I would say just be very cautious about eating that.
Sure.
If it's supposed to be healthy, like yogurt, for example, right? But if, I mean, obviously if you're eating like candy or sweet, then it's going to be sugar. But just being mindful of like cereals that say that, it's high protein cereal, but just be mindful of like how much added sugar is in there and what the ingredients are. So I believe that one of the things that's contributing to a lot of insulin resistance right now is a lot of these added sugars that are in foods that we think are healthy. So we think we're making a good choice, but unknowingly we're consuming all this added sugar.
Fabulous. Yes, and I agree with her 100% on that. And even with, and you'll also see this a lot of times when you read those labels, you're not going to see the word sugar. They cheat, don't they?
True.
They cheat a lot.
Yes.
There are a lot of artificial sweeteners out there that screw up insulin resistance. We're seeing a lot of that. We heard about this years ago with aspartame in the sodas. And then people say, well, I just won't drink soda, but they hide aspartame in lots of stuff. And now they're using compounds that sound like sugar, which is frightening. So I read the back, and if I see the term sucrose, that's table sugar. Okay, but that one's actually almost easy to figure out. Then they'll throw in another term called sucralose, artificial sweetener. And so there's a lot of cheating going on. They're even using salts and changing their chemical makeup on one end to make our tongue think they're sugar, like a sulfamide potassium. And it's gotten so hard for the average consumer to understand what they're even reading on the back.
Yeah, that's a good point. I'm glad you brought that up. That it doesn't always say sugar. It's
That's
actually
right.
hidden as other things that are actually sugars.
You
but
bet.
They're
Maltodextrin
like code names or different names.
They do. They have so many code names, and I've done I've done a lot of research on this, and I've done a few seminars on this. When I do my dietary seminar, I do a weight loss seminar, and that's part of it. I take a short period and try to explain to people, look, you're eating a lot of stuff you don't even know. Like you said, that is sugar or artificial sugar, which tricks our body into thinking it's getting sugar. Insulin is oversurged and there's no sugar to eat up. What a nightmare, right? The world has gotten hard to navigate. Insulin resistance, correct. It builds that very heavily. And everybody thinks, well, I eat sugar-free or no sugar stuff. And I'm like, wow, you're actually hurting yourself even worse than you think you are by trying to use the fake sugar or artificial sugar that's sweet to the tongue. Digestion starts right here, right? And I tell people, I says, as soon as something hits our tongue and we think it's sweet, before it ever gets to our stomach, that insulin's already started because it's connected. The nervous system tells it sugar's coming. Yeah. And if no sugar gets there, it's just an artificial sweetener that does not process. What a nightmare. How dysregulated does insulin become over time if you keep doing that to it? And so we see all these folks who thought they were doing well by avoiding quote-unquote sugar, and they're eating the wrong kinds of stuff. It's worse for them. And so I always tell people that's a real two-edged sword in our culture.
I think, like, to simply answer your question as well, like, for someone who wants to know, like, hey, where do I start? So try to eat more whole foods, less packaged foods, less foods with, like, barcodes and labels, and trying to stick to whole foods. And usually you can avoid most of those things. It's a whole different conversation getting into, like, organic foods or not, but...
Sure.
Isn't that kind of like what you say, like always shop the outer edges of the grocery store? I was just
going to mention that. Yeah, I tell people, I says, when you walk into the grocery store, if you just start in the front and then make a ring around the outside, you're pretty safe. Yeah, just leave when you get back around. Everything in the middle has been meant to sit there. And it's all packaged food, and a lot of it is, really our curse. And so, if in the grocery store, you stick to your fresh vegetables, fresh fruit, hopefully fresh meat. Even that's becoming an issue. We talked about that earlier. Meat is becoming a problem. A lot of that you might want to outsource to your local farms if you can do it these days, where there are people who are actually processing meat without all of the preservatives and the chemicals that go into them, because some of that is hormonally disruptive as well. And then you combine it with meat where it's saturated in a fat, and it gets even more complicated. But then stick to your dairy aisle and try to cheeses and stuff like that, yogurts, but look for ones that are overly laden with sugar. But you can kind of shop that outside and then sneak back out. Try to stay in that Whole Foods area, right? Yeah, food that looks like food, not that came in a box. Exactly. And I love that you said that. That's really good. Yeah, we talk a lot about that, and I try to tell my patients, try to stay where you can actually pick up things. Go to the deli counters and go to the places where you can buy something that is actually fresher and hopefully processed right there in store. That's a little harder to find. Yeah. But local farms are doing better at a lot of that kind of stuff for your meats and some of your dairy on occasion. That's getting to be a big thing now.
Yeah, definitely. And farmers markets too.
Absolutely, for vegetables. You betcha. Yeah, absolutely. If you can get the farmers markets, they're fantastic. A lot of the local farms are trying to do their best not to overspray, not to over glyphosate everything, to keep weed killers and stuff out. And nobody's perfect. The rainwater is still raining on it all. I tell people, I say, organic is only so organic. But the less of it we get, the better. And it's just our job to do our best to try to find the good sources and just to eat better as a country, I think. All right. Well, Dr. Almeida, this has been a great pleasure. It's so great having you here. Thank you for coming out. Hopefully, like I said, we'll get together and do a big roundtable discussion of a lot of this in several weeks to come. But it's been a joy.
Thank you so much for having me. I really enjoyed our conversation.
Excellent. Okay, and please like and subscribe to our channel. Keep us up. Please ask questions. We'd love to answer more. Half of what we do is because of y'all, so keep us in your mind.